Can I go ahead and start?
Yes, ma'am.
Hey,
Good afternoon.
can you hear me?
Good afternoon. This is Dr. Ollie Jones. I am the co-president of the Ohio Grandparent Kinship Care Coalition, and we want to welcome you this afternoon to an awesome presentation around the COVID virus and the impact on grandparent raising grandchildren. We have some awesome speakers for you this afternoon, so please get comfortable as we go through the next hour and a half. Our speakers are very well trained, very educated in their area of expertise. I will give them in the order of their presentation. For time's sake, the first speaker is Anna Beltram. Anna Beltram is an attorney and special advisor to the Generation United. She has been working with the organization since 1999, its conception. Anna heads Generation United collaboration with ABA, Center on Children and the Law, which creates and maintains grandfamilies.org. Anna also provides technical assistance and training on the breadth of kinship care issues and has worked to help enact and implement several federal and state laws to support the families, including Family First Prevention Service Act, the Fostering Connection to Success, and Increasing Adoption Act, the Adoption Act of Family Caregiver Support. She speaks nationally, impacting grand families and published many articles around reports. Anna is admitted to the Bar Association in Maryland, Washington, D.C., Washington State. She founded her true passion in 1999 and began working to support grand families. Our second speaker after Anna will be Yvanka. When I first heard Yvanka speak, in my head, I said, she's a fireball. She's dynamic. She is the executive director of the Northeast Ohio Black Health Coalition. She's the director and founder of the Cleveland-led Safe Network. She's a PhD student at Kent State University and holds a master's degree in public administration from Texas Southern University. She is nationally known and recognized in the area of health disparity and served on national networks for justice, Council for Black Health, Ohio Healthy Homes Network, Health and Human Services Region 5, Health Education Advisory Committee. She was elected to the Cuyahoga County Democratic Party Central Committee representing District N. In 1974, her mother was murdered, and it drastically changed her life, her childhood, which promised her to use her life to help others, has led to the creation of cutting-edge programs, and she has impacted thousands around the country. After Anna would be Beth. And Beth is director of the advocacy at Reach for Tomorrow. This organization brings awareness, education, and support to individuals in active addiction and their families, providing trauma training, which is key, restoration training, and human trafficking awareness and education, and direct other outreach services to victims of human trafficking and domestic violence. She is a certified trauma practitioner, certified victim advocate, and is a certified mental health first aid. After Beth, we will have Tara Hooks. And Tara is coming to us from the Ohio Department of Jobs and Family Services, Office of Children and Family. And then after her will be Karen Dawson. Karen Dawson will be talking to you on behalf of CareSource Managed Care. Thank you so much, panel. for your commitment, your level of expertise as you bring to the coalition and to this webinar. So I am going to turn it over into the hands of Anna. Thank you, Anna.
Apologies, I was muted there and I couldn't unmute myself. Good afternoon, everyone. This is Anna Beltran with Generations United, and I'm very pleased to be with you all again. I was at the conference in October, and I got to hear a number of the speakers who are going to follow me, and I know that you're in for a treat with them, and hopefully I won't bore you to death. Anyway, good to be with you all. So today we're going to talk about, the pandemic and its impact on grand families, which is unique. When we're all facing challenges with this pandemic, all families, but grand families are facing certain unique challenges. And why? Well, there are a number of reasons. One of which is most of the caregivers, or many of the caregivers, are age 60 plus or immunocompromised or both. And so unlike other families, unlike older individuals like them, they cannot isolate themselves from children. They have to raise them, right? So you're raising them, you're taking care of them. You can't go into a separate room or a separate house like other grandparents or other older relatives. So you're all in it together. So that's already putting you at a greater risk than other families. Then there are all the financial issues. So if you become a licensed foster parent or you take care of a child in the foster care system, everything is reversed from what it is with a non-kinship family. So you get a child placed before you get licensed, before you get any kind of financial support. So that is a real big challenge. If you don't have financial assistance to meet the needs of children that you didn't plan or expect to raise. And then for those many more caregivers outside the foster care system, of which there are just many, many more, how they have very limited financial support, as you all know. Usually the only thing available is temporary assistance for needy families, and it can be difficult to get a child-only grant. And then there are the legal issues. If you don't have guardianship of the child or legal custody of the child, consenting to services and accessing help can be challenging. So there are just many challenges that make the challenges that kinship families have been facing during this pandemic that much more severe and unique. And so local communities and decision makers and the state and the feds need to think about kinship families when they're rolling out the responses. And we want to empower you to do that too, to bring these issues to your local decision makers and to give you some resources today. So that's my goal, basically. Now, what we're hearing around the country is, this is kind of a chart of or a visual of all the challenges, or some of the challenges that we're hearing about. One of the primary ones being food and supplies. How do you get it? How do you get it safely? There have been some responses around the country, and I know there have been some great things going on in Ohio as well, but the challenges of going somewhere like a Costco, which has a dedicated hour for older individuals, but you're strictly, at least here, not allowed any guests. So how does grandma, who's taking care of a 4-year-old granddaughter by herself, get into Costco? So she has to go with everybody else. And then that health benefit is gone, right? That safety net is gone. The drive-ins can work, but it can be a long wait. It can be very challenging with small kids in the car. So there's just a lot of challenges around that. There are some responses that are happening, including some more funds available through SNAP or food stamps. And I know that Ohio has been approved for what's called the pandemic EBT. And I'm sure some of the speakers after me will give you some details about that. But Ohio's been approved by the feds to provide some additional resources and additional food through that program. Financial assistance, you know, we're all our communities are impacted by people losing many jobs, by the retirement savings that are kind of going up and down because of the stock market. And so how do we meet the needs of these children in this financial situation? Now, some states are responding by increasing their foster care maintenance payments, for example. New Mexico gave every family, for every child in foster care, another $175 for that child each month. There have been the stimulus payments, and there is a guide to those payments. I hope you've gotten yours by now, but there is a guide if you have not on our website, which I'll share later. So some more tools there. So we are seeing folks respond, but it's piecemeal, like with everything kinship, right? It's all in silos. So how do you navigate this whole puzzle? Technology and virtual support. I'm sure I'm preaching to the choir here, but you know, how do you help kids when everybody's got to be on a computer, accessing school, and you know, there are only a limited amount of computers, and how do you provide the tech assistance to them? Because not all kids can manage it, even though there's that myth. So how do we do all that? The child welfare system issues, the visitation, doing the virtual visitation when you can, really keeping yourself safe as a caregiver, as an older caregiver, or as an immunocompromised caregiver. Really take care of yourself as well. And, you know, abide by those parental visitation orders to the best of your ability. Do it virtually where possible. Keep good notes about your efforts to connect the child and the parent. You know, there are solutions. The feds have made some flexibility as well around all this, which we'll talk about in a bit. Then the alternative care plans. So we hear about this all the time. You know, if as a parent, I can name my sister in my will and she'll take over in the event of my death. But if you don't have legal custody of children that you're raising like your own, how do you make plans for the event of your death or disability? So there's solutions around that as well, and help around that as well that needs to be, and we need to engage the legal community where you live for that, you know, in each of your towns, because it's really important to make those secondary plans. So we at Generations United have created a summary of the CARES Act. That CARES Act is that big $2 trillion bill that passed Congress a few weeks ago. It's the one that provides for the stimulus payments to individuals and to dependents. It's the bill that provided quite a bit of flexible funding as well. So every state, tribe, and territory is getting flexible funding. That means it can respond to the needs of Ohio and the community, the larger communities in Ohio. So Ohio is receiving $4.5 million of that pool of flexible funding. 3.7 million, as you see, is going to the state. And then there's another 775 going to local communities with populations over 500,000 people. That's the way the federal law is set up. So that's the allotment that Ohio is getting. So hopefully they're using the part of that 3.7 to serve rural communities that don't meet that threshold of 500,000. Also receiving a share of what's called the Governor's Emergency Education Relief Fund. So that provides a lot of flexibility through the schools. So it's important to know about that so that that money can also serve kinship families in Ohio. There's also a lot of federal support that's coming down from this act for specific programs. So child welfare got more money, education got more money. This whole list of folks essentially got more money. TANF, Temporary Assistance for Needy Families, did not get more federal money yet. We're continuing to advocate for that, but it was reauthorized, which is important, and we will keep pushing that. There's also in that bill help to nonprofits serving grant families, so that if you're a nonprofit, you might be able to get some tax credits, a loan, and you might be able to have lower costs for any employees that you had to let go so that they can get their unemployment compensation. So the act does a number of things, and that that document that I linked you to, and it's linked on this page, and everybody will get the slides after this, goes into a little more detail with respect to all this. And know that I'm always, please consider me a resource. If you have any questions, you'll have my email at the end, and feel free to email me. There's some additional national efforts that are going on to respond to the crisis. The Children's Bureau, which is the national oversight of child welfare, it's part of the U.S. Department of Health and Human Services, and they're the ones who give all the federal money anyway down to the child welfare agencies. So the federal money is important, of course, to all the states and tribes and territories. So the Children's Bureau when they issue guidance, it's incredibly helpful and powerful. And they have really been churning it out lately. And there are a couple of links here to some memos and program instruction that I find really powerful. The first one is kind of a reiteration, because they've already said this in another document they put out, but the federal government is telling the states and tribes and territories that they have to consider your voices, birth parents' voices, youth's voices, anybody who's impacted by the child welfare system, their voices should be at the table, and they should be included in all aspects of child welfare design and delivery, and really authentically, not, token engagement, but really, really emphasizing that. It talks again about the preference for placing children with relatives. That is a federal preference that's been in law for over 20 years. Every state has a preference as well for relatives. Some emphasize it more than others, but there's research, there's data, and there's federal law saying that if there's a suitable relative, the child should be placed with the relative over a non-relative, if it's safe and appropriate. And this piece, again, emphasizes that. It emphasizes the research that shows that the why of that, and then it really emphasizes it to the child welfare agencies. So more and more we're seeing, and I work with several child welfare agencies around the country, and more we're seeing them trying to do better by kin and be more equitable to kin. And then it's got a nice piece about talking about how birth parents and foster parents, and that can be kin or non-kin, really should look at each other as mutual resources. So the birth parents, can learn from the kin and the non-kin during that placement when they can't be with the birth parent. And then when they go home to the birth parent, if they go home to the birth parent should continue to look at that kin and non-kin as a resource and keep them in the child's life if possible. So it's a really nice piece of guidance, I think. Then most recently, just about a month ago, the federal agency said that federal child welfare money, and this is huge, can now be used to pay foster care maintenance payments rates during provisional licensing. And provisional licensing really only impacts kin, essentially, and fictive kin, because it's a process where the child's been placed with you and you get a provisional and emergency license during that placement until that person can get full licensure. And now for the first time ever, the feds are saying you can use our money to pay foster care maintenance payments rates during that period, which can be a long time. It can be 6 months easily. And before that, kin had just been struggling during that period. It allows extending foster care maintenance payments for youth over 18, which Ohio is doing. And it allows states to modify the employment and education requirement for youth over 18. And Ohio is also modifying that. So there's a lot more flexibility these days. Also, outside the child welfare world, there is now additional federal money for the National Family Caregiver Support Program. And I know that some of your age agencies on aging in Ohio serve grandparents and older relatives, age 55 plus, who are raising children. That age limit is in the federal law, but it allows many caregivers to be reached to provide support groups, respite, and other services. And so there's more money. There's $100 million more nationally for that program, and there's no more cap. For 20 years, there's been a limitation that states can only use 10% of these funds to serve kinship families, and that cap is now gone. So communities, area agencies can respond based on their needs. So if they have more kinship family needs than family caregiver needs, because that's the other population that program serves. So people like me, boomers, I'm, 55 and older, caring for parents, with Alzheimer's or the like. So that program can also serve them. But before, it was 90% of the money had to go to that population. And now it's much more flexible and communities can respond based on their needs. We're also really working hard at the federal level with our partners at Children's Defense Fund and others to ensure that additional funds are available for kinship navigators. I know you have a new program and it's going well, and you have a lot of nice state money, but a lot of kinship navigators around the country do not have state appropriations as well, so they're struggling. And we want to also be able to make sure that kinship navigators around the country understand that there's flexibility with the funds, federal funds that they currently have, to provide food, supplies, financial assistance directly to you. They don't just have to use it for their administration and for case management and the like. They can use it for direct stuff. And we're also advocating for more money for temporary assistance for needy families, which is a very important resource and support to so many kinship families around the country. We also created this Leave Behind for Local Decision Makers document. So if you're up for doing some advocacy, which I'm sure a lot of you are, and I know a lot of you do, this is a tool that you can leave behind when you meet with a local decision maker. That could be the head of the housing authority, it could be the area agency on aging director, it could be your mayor, your state legislator. And this just provides kind of some background on who kinship families are, what their general needs are, and then kind of walks through some of the programs in that some of the funding in that CARES Act, and pulls out some specific things that local decision makers could do. So the two pieces go together, and this purple on these slides is where it's linked. So you'll be able to access all these documents for free, no problem. Now, if you want to take all these tools and resources and CARES Act summary and figure out how Ohio and how local folks can better support you with this new federal money, you could set up a meeting with a state or local decision maker. Research who's best to talk to. What we find is really helpful is finding out if they have been impacted directly by kinship care. I mean, a lot of lawmakers out there are raising kin, were raised in kinship care, making that connection so they really feel it. That can be huge. Learning about what the issues that are important to them and making a connection there. And then the power of strategically sharing your story during that meeting. And when we talk about strategically sharing a story, we mean you go in there and you share it in a thoughtful, safe way. You don't have to give every detail that makes you feel uncomfortable or that shares too much about your, say, adult child or grandchild. And you don't have to answer questions that you don't feel comfortable with. Hey, what kind of drugs was your daughter addicted to? I'm sorry, but I'd rather not answer that. I'm going to talk about it. So, really thinking about what you're comfortable sharing, what's strategic to share in terms of what you want to accomplish by the meeting. Say you want better housing, you want some more housing like you have in Cleveland for grandparents raising grandchildren. Make your story about housing and then make the general ask. And you don't have to be a policy expert at all. Lawmakers, they really rely on the personal stories to make their case. So if you give them the story, the general ask, that's what turns the needle. It really is. It's what makes all the difference in terms of any advances we've made for kinship families over the years. Some additional resources I want to share with you. We have a website called grandfamilies.org where we share, we do this with the American Bar Association and Casey Family Programs, and we try to keep everything national, at least, that's kinship related. There's also a search laws button in the middle there, and that is a database of state laws. It's a bit outdated, but it gives you a starting point. If you're interested hey, I know Ohio has an educational and healthcare consent law. Where is it? Well, you go in there and you put Ohio and you put educational healthcare consent, and it will spit it out for you and you can read it. And you might want to double check it, make sure it's still the latest and greatest, but it'll give you the ways to do that. We also have a new fact sheet that we just put out last week that's linked on this homepage at grandfamilies.org. It's at the bottom in latest news. And it's an 8-page document with national figures and challenges and strengths of the families and the research that shows how children thrive with kin. That, they just decades of research that show that children do better when they're placed with relatives. That's all in that 8-page fact sheet or so, and you're welcome to download and use that and disseminate it and share it. All of our resources, you're free to share and copy and do whatever you like, as long as you give us credit, that's all. I mean, as long as you don't modify the content of the document. Also on the Generations United website, we have a COVID-19 page as well. I'm sorry, I failed to mention that on grandfamilies.org, we have a dedicated COVID-19 page, which you can find from the homepage down in latest news. And on the gu.org website, this is GU for generationsunited.org. Right on the homepage, you'll see a very easy link to COVID-19. And there are a number of resources, including all the ones I talked about today. Well, including the Generations United's resources I talked about today. All the resources that I talked about today are on the grandfamilies.org website. We've also done a kind of a basic fact sheet about, how to talk to your grandchildren or other kin that you're raising about these issues, how to, keep yourself safe. And this is in English and Spanish, and you're welcome to share it in your communities. We're also in the process of creating a version 2.0, which will be have more resources for the children, and you're helping to support the children. So be on the lookout for that. That'll be posted at both websites as well. And then please consider me. I love Ohio. I've been there a number of times. I'm from Indiana, so I feel like I'm in my own backyard. So please consider me a resource at any time. This is how you can reach me. And it's just a pleasure to be with you all. And I'm looking forward to hearing from Ivanka, because I heard her last fall and she was fabulous, and you're gonna be moved, I'm sure. So I will turn it over to her, and yes, please consider me a resource, and thank you for having me.
Do you want her to do that question first? That's on the chat. Okay. Hello? Can you all hear me? Okay. So I am the executive director of the Northeast Ohio Black Health Coalition, and the Northeast Ohio Black Health Coalition is the first coalition in the state of Ohio to focus exclusively on African-American disparities in education, employment, housing, and health by working to educate, advocate for, and empower the community. Our membership includes sociologists, medical geographers, lawyers, nurses, doctors, activists, and community members. And so today I want to talk about the SOS that I see. And so the SOS is stress in our seniors. And I think that I could probably add another S on there that would say systems in our seniors. Because, one of the things that we do know is that we are, our seniors are having a rough time with some of these systems being shut down. So what COVID-19 has done for us is shine a light on the social determinants of health and the problem of systemic issues centered around access, accountability, and racism, whether we're talking about education, employment, housing, and health, and how those systems are included within our kinship care networks. We can no longer jaw jab about all of the great things that have been done for Black people while stepping over the bodies in the street. African Americans have more of the circumstances that make it harder to survive this pandemic. Deep-rooted poverty, pre-existing medical conditions, less access to healthcare, less stable employment. And for our seniors, a lot of our seniors are retirees. And so they're raising either family members or other kin off of a retirement income or off of smaller incomes than people are working. And so what is going on is you have children now 24/7. And so you have children who have needs that are 24/7, and you have your own needs. And so for many of our seniors, they have these comorbidities. So they have issues that disproportionately impact them and make them more likely to have some of the things around COVID-19. So it's impacting the community disproportionately because of comorbidities related to poverty. Racism is exposing existing inequities in our healthcare systems, in our educational systems, in our judicial systems, which we know that a lot of our families that had judicial meetings, those meetings were canceled because the courts were closed. And so because those courts were closed, a lot of the things that needed to happen around seniors having their grandchildren or children that they're caring for with them, or children being put into other systems because those systems were not functioning. The employment and our social systems. So COVID is not choosing Blacks as systems as victims, but rather it's highlighting the disparities that existed before this emergence. And so it's important for us to look at some of these systems. So at a time of crisis, what we looked at is these systems that have been completely shut down. So when the school systems closed in the middle of the month, so the school system shut down mid-month, and all of a sudden, parents and caregivers had to figure out where they're going to turn for services. How are they going to get lunches for those children, the children that they have at their homes? What our systems failed to do was adequately respond to the needs of our caregivers. So if a senior has a comorbidity and they're saying, hey, if you have hypertension, if you have heart disease, if you have diabetes, if you have cancer, if you have other types of health issues, we want you to be quarantined in your house. So we want you to make sure that your visits outside of your house are lesser than normal. And so what the school system said is to the children, they closed the systems down and then sent the children home and said, okay, well, if you want lunch and breakfast, you need to return back to our systems, right? And so we have grandparents who are caring for children who they're hearing things on the news because a lot of grandparents watch CNN all of the time. And so they are caring for children and the system is saying, we need you to stay at home and we need you to make sure that your children are staying at home to not put you at risk. And now our system is saying, we need for your children to go to a bus stop, to get on a bus, to go to a school, to get in a line, to wait for a lunch, to get back on the bus, to go back to that site, and then to walk back home. And so what has happened is a lot of our caregivers were not able to connect their children with systems around food access. And that has been something that has been a dire need here. We have almost 39,000 children in a municipal school district here in Cleveland, and the school district has only fed 350 families for this time that we've been out. So less than 10% of the families have been fed. So we have to look at this and understand that that is an egregious gap. When you have children who rely on school breakfast and lunch for many as their only meal, and now they're home with their grandparent, and the grandparent has no extra income. And remember, we're talking about the middle of the month. This happened on March the 15th. So the middle of the month, now I need to feed you breakfast, lunch, dinner, and snacks for the remainder of the month. Is more month left than money. And so we have to understand that that is something that has to be addressed. The other things was that shift systems shut down. We had systems that immediately said, we're closed. And so if you needed to access those systems, if you needed to be able to talk to someone on the phone, there was no one there. And there still is. For many of these systems, there's still no one there answering the phones. The phones are going into a recording. And so our parents have looked at this as nowhere to turn. And so we look about resources. What resources were available or are available to grandparents. So you're sending children home without a computer, who don't have a computer at home or may not have a tablet at home, and you're asking them to continue their work, and they don't have Wi-Fi. And so now you're saying, if you don't have Wi-Fi, you can drive to McDonald's and use the Wi-Fi at the local McDonald's. So what happens when grandma doesn't drive? How are the children supposed to be able to access vital work in order for them to complete their studies? What happens when the caregiver is illiterate? What happens to the needs of the children? So for me, I was raised by my grandparents after my mom was murdered. And we were not in a Wi-Fi or computer access world. I am a grandmother myself. And so I have plenty of computers. If my grandchildren, who are very young, needed a computer, they have access. They have access to Wi-Fi. But what happens when you don't? So what the Northeast Ohio Black Health Coalition did was to relieve some of that stress that was on our caregivers, particularly about, I know Ann talked about going to Costco and having those hours in the morning, but Costco is a membership business. And so if you are a grandparent and you do not have money, having a membership to Costco is not going to work because you don't have it. The other thing is Instacart. People were like, oh, they can just order an Instacart and have Instacart deliver their food. There is a charge for Instacart, and Instacart may not come today. Like, you may put in an order for Instacart, and Instacart may not come until tomorrow or the next day. It depends on how busy that server is that day. If Instacart is busy, it can take them up to 4 days in order for them to get your order prepared. So if we have things that are priorities right now, then we cannot afford to wait for Instacart. So we have to talk about those stressors, the stressors that our grandparents are going through, the mental stressors of listening to the TV, of seeing, of hearing, and knowing certain things about this virus as the days went by. We had grandparents who, because they thought that they were safe in their homes, were hosting card parties with their friends. And so the kids are there, the grandparents are hosting parties, hosting a card party. And we had last week, we had a group of 10 who hosted a card party, and almost all of the members of the group died. And so we have to talk about risk factors, and we have to talk about what happens to the children if something happens to the grandparents. So if you have caregivers who are caring for children and they're putting themselves at risk, or the children are putting them at risk because the children have now been told that in order for them to get food, you need to come to us. What happens if something happens to the grandparents? The other thing about the automobile is many of our food banks initially in their first distributions said, unless you have a car, you cannot get a box. So for families who do not have a car, they could not get a box of provisions. Then they also made the rule where you could not ride in someone else's car, and they give you a provision and them a provision. And when they realized that it was being biased, they changed the rule and said, okay, you can come in someone else's car, but you just have to prove that you're not at the same house. And so we're talking about provisions for people's life. So if I don't have a car and my neighbor has said they're going to be able to drive me to get the things that I need, and now we get to the place where food is available, and the food center says, well, guess what? You're not driving. So we can't give you a provision. So we really have to look at how our systems have worked, because our systems have basically shut out many of our seniors. You know, one of the things I was going to say to the people who are listening is that it would be a great opportunity for us to do a survey of caregivers and find out what services that they use and what things that they lacked. So the Northeast Ohio Black Health Coalition, we focus on health disparities. And so one of the disparities that we knew about, a big disparity that we could address, was food disparities. And we know that not having food is a big stressor in our community. If you go to your refrigerator and you have children to feed and there's nothing there, you're stressed. And so we're talking about grandparents who are already ill, and now how am I going to feed these children? So we created a program called Babies and Brunch. So Babies and Brunch is a food delivery program where we have been delivering food to families that had kinship caregivers who were taking care of them, caregivers with disabilities, children with disabilities that could not get to any of these food sites. We collected dollars for the food. We purchased the food. We started off originally doing it every single day, but then after the governor's orders, we started doing it every other day. Then it went to a week, bi-weekly. And on Sunday, we actually sent out 5,000 breakfast, lunches, and snacks from my house for those families. So we have been doing that for 10 weeks. In the last 10 weeks, we have sent out 20,000 meals. I started off doing this with my credit card, not because I thought I had all this money, but because the need was greater than me saying, I'm going to use my credit card and figure out how to pay it back. We have a community that is suffering. I can't feed all of the 39,000 students in the Cleveland Municipal School District, but what I can do is look at a group and say, how do we get services, access to the people who need it most? And for us, it was kinship. It was grandparents who were taking care of grandchildren. It was people who were disabled. It was parents who had disabled children. Not only did we take them food, but we also have taken them masks. We've taken hand sanitizer, soap, toilet paper, all of the things that they need. When we took our provisions to our families on Sunday, they received a menu for the month. They receive food for the whole entire month. So they don't have to, they have a menu that covers all of their meals from now until next month when we go back out. And we also gave them a gift card where they could order, if they ran low on bread or milk, they have a gift card to buy some more bread or milk, because we gave them bread, we gave them milk, we gave them apples, we gave them oranges, we gave them all of the provisions that they needed in order for us to make sure that the children not only had breakfast and lunch and dinner, but also snacks. The other thing about the school programs for kinship families was the school programs initially only wanted to feed school-age children. So what happens if you are a caregiver and you have a child who is in kindergarten or first, second grade through high school, and then you also have a child who is 1, 2, or 3, or 4 years old. So the school was originally saying, well, we're only going to feed the ones that are in school. So who eats? And so for a lot of our caregivers, I think that they said, okay, we have to find out other ways. And so when we think about stress and we think about the things that our caregivers have been going through, we really have to look at these systems that say that they are culturally competent. So we have systems, and cultural competency is understanding how systems work. That is what cultural competency is. But what I am telling you, and what I am telling you who are working in systems, is you need to be culturally aware or culturally proficient. You need to understand how people work. People work different than systems. Families are different from families to families. So we have to also understand that if we have caregivers who are getting a check every month. That remember, we also have had family members who still have not received a check yet. So grandma is only trying to take care of the grandchildren that are in her care off of that check. But she may have other children who are beauticians who just received their first unemployment checks last week, 7-8 weeks in. They may have other people who have not received. We still have a third of the people in the state of Ohio still have not been approved for benefits. And so if those people are relying on folks and families, who are they relying on? They're relying on a person that already has money. And so that person is grandma or granddad, like someone who has some dollars that they're going to have at the first of the month, because that person is going to try to help out their kids, because no one wants to see their children suffer. So COVID-19 has shed a light on all of the things that we have talked about year in and year out around caregivers and the things that go on when people are caring for children, when money is low, when school systems fail, when the job markets are crumbling, or if you're having some type of housing issue. And so for us, as the Northeast Ohio Black Health Coalition, we have to recognize and document the social factors that contribute to these, the rates of illness. We have to understand that the quiet and systemic issues, the harms that are continuing in our community, are not small harms. These are things that can impact children for the remainder of their lives. So when we sent out meals from here, we didn't send out things that people didn't want to eat, because I think that's the other thing too around some of these food programs. They send things to you that you would not have eaten because it was the last things that was in their cabinet. So people get what they don't want. And so what we asked for feedback from our parents and our caregivers, and they said, you gave us real food. You gave us food that our children wanted. And you gave us healthy and nutritious food, and the children are excited to see you all come. So in these last 10 weeks, I've got a chance to see, some of my families. It's basically through the door. I found out some of their issues, some of the things that they need, whether they were in domestic violence situations and fleeing domestic violence situations and living in a safe house, and we delivered the food to them, and it kept them from having to leave the safety of that house. Or grandparents, making sure that they did not have to leave home in order for them to get the nutrition supplements that their children needed for proper brain growth and development. We made sure that we tried to make sure that their stressors were the least likely things to fall on them at this current time. Now, we have to also realize that we have a number of other things that have gone on in our community recently, that our children have now witnessed the death of Mr. Floyd. So when we talk about the COVID crisis, we have to also talk about the things that are going on in the community and in the households, and how grandparents are probably a lot more hypervigilant about bringing in children and making sure that their children are close to home. And so we cannot take any of those things for granted. Kinship care is more than just taking care of kids. Kinship care involves caring for a holistic approach to human beings and making sure that we're treating them as such, and that this is not about systems. This is about people. This is about how do we make sure that our kinship caregivers have access to the best quality things that they can have, not only for the children that they're seeking to serve, but for a better quality of life for themselves also. Thank you.
Thank you, Yvanka. Up next is Beth Bullock.
Okay. Can everyone hear me okay? Okay, there we go. I'm going to try to do a screen share. Where is my, here we go. Okay, can everyone see everything okay? Okay, I'm not hearing any of you. Okay, so we'll just get started. We're going to talk about trauma and how trauma affects children and their development, and also how that works in with what we're going through currently with the COVID crisis and all the other things that we're currently going through. So as long as, we're just going to cover trauma in the way that, what is trauma? Trauma is just simply a psychological and emotional response to an event or an experience that is, I'll put this down a little bit so I can see, that is deeply distressing or disturbing. Basically, when someone experiences trauma, it can be a real event, it could be a perceived event, such as some type of a threat or a terror, something they've seen on the news, or something that they hear family talking about or people around them. It can be an event that they experience that has brought real threat and terror to them. Trauma in that sense then can affect, depending on the severity of the trauma, can then affect how a child's development will continue after that. So when we're working with children who have been pulled into placement with foster care or with kinship providers, we know that at a certain point, children have experienced trauma for one reason or another. They wouldn't be in placement if they hadn't, to some degree. And I know that's not in every case, but in a lot of cases. So when we don't know, when they come to us, we don't know what this child has been through. We don't know what they've experienced, how those experiences have affected them. And we may not even see that come out in them for a little bit of a time. The child that we work with, that we have, some of you have heard our story. We had him for about 6-8 months before he really started acting out. And we finally started realizing that there were some issues going on there that he needed trauma therapy for. And then once we realized that, we were able to work through that. The majority of foster parents and kinship providers that I work with have some kind of training when they go through their foster care licensing, but the majority don't have a really good solid understanding of what trauma is. So many times these outbreaks or these outbursts that kids have when they're acting out, whether it's in violent tantrums or crying or maybe feeling withdrawal, we don't necessarily recognize that this is a traumatic thing. We might think that they're just angry, or they're just not reacting properly to something, when in fact it really is a traumatic event that has happened, that now that they're safe in placement, they're starting to see and have nightmares, and these things are starting to come back to them because they're in a safe place. So when trauma happens, and you're in a situation where it could be complex trauma, it could be something where there's been abuse repetitively over and over, or it could be one event of some type, that fight or flight response kicks in. And if you've ever been in a situation where you got immediately scared to death and something was like, oh my gosh, this is really scary, your heart beats faster. You start breathing faster. You might break out into a sweat or of some kind, because your body is registering this. That fight or flight response is basically our survival skills. And with those survival skills, we stay in fight or flight response after that for a good bit of time. And when that heightened fight or flight response is kicked into that survival mode, our reactions to things aren't what typically they should be. They might be erratic. Our reaction to something might be out in more of anger, or it might be out in something more of just breaking down into tears. So it definitely affects the child's ability to react in what we might consider to be more of a normal way. So when trauma happens at a very young age, and this is just an example that you can see of the root of trauma. It could be a lot of different things. It could be domestic violence. It could be abuse. It could be all kinds of things. When trauma is left untreated, the brain doesn't necessarily process this trauma properly. It holds things in. Things that might happen after this in later years can trigger those experiences, can trigger that fight or flight response, so that when we are triggered by something that we may not even realize, it could be a smell, a sight, or a sound, or maybe seeing the face of someone we haven't seen in a very long time that had something to do with our trauma. When that is triggered, then we act out. When we have children that are coming into care, they're already traumatized. We're seeing some of these depression and some of these abilities to not maybe interact with other children or other adults properly. They might be hypervigilant. They might have show more anger, more panic attacks, more anxiety, depression type things. These are all things that stem from trauma. And untreated trauma just pushes this a little bit farther. So as they grow, they become more and more depressed, more angry, no treatment, the thoughts aren't processing, the experiences aren't processing, so they're stuck in there. And then once we start getting older, that's when a lot of the addiction issues and things that we have is because people are then starting to self-medicate when they start getting to a certain age, and those things become available to them. And that self-medication a lot of times can, lead into addiction. The majority of the women that I work with who are in their late teens, early 20s, who are in addiction situations and have been in addiction for quite some time, almost every one of them have some kind of a traumatic incident or a series of incidents that has happened over their lifetime or as a very young child that is now grown into this need to self-medicate so that they feel better. As we're going through, there's been a lot of changes. I mean, everybody being, coming and staying home, children who may have been brought into placement, now that they're in a stable, secure home and they're safe and their needs are being met where they weren't before, now they have another upset. Well, now I can't go to school and see my friends. Trauma also affects confidence and self-esteem and things that socially they need for themselves to develop and to grow into healthy adults. So then when they're not having those conversations and they're seeing the teachers and seeing their friends, now they're at home. Many children don't understand. They don't understand what COVID is. They don't know, as much as we try to explain it to them, they don't necessarily understand what that is. So then the questions are, well, why am I staying home? Why can't I go not see my friends? And even though we explain that to them, they don't always necessarily understand that. So the other thing that I've been seeing a lot and hearing a lot of is the effect from this is not being able to visit with their parents. That's can be some type of maybe a form of rejection. And I tell this story a lot when I'm doing trauma discussions and things, because this really helped me see from a child's standpoint and understand a little bit more about children who are coming into placement. And someone said to me once, well, the child, foster kids, and they just feel like they're abandoned and they feel like they're rejected. The rejected is the word he used. I'm like, well, why? They're maybe leaving a bad situation. They're coming in with a loving family or, their own family who's going to be taking care of them and they're safe. And he's like, no, he said, a child living in this type of an environment may only know that environment as being normal to them. That may be all they know. If they're being abused, that to them is normal. That's what they understand. They don't have other examples possibly of what might be going on. So someone from Children's Services comes, removes them from the home. Well, mommy and daddy don't stop them. They're letting these people take me. They must not love me. They get into a placement. They're safe, secure. They're feeling like things might be kind of settling down a little bit. The nightmares start coming back. The feelings start coming back. This is when trauma starts to surface, is when they're in a place where they're starting to feel safe. Well, then they start acting out. They start acting out at school. They start being angry. They may start having physical behaviors of acting out, maybe in anger or violence that they've not had before. Foster parents, even kinship providers who aren't trained on trauma to understand what trauma is, a lot of times that can be maybe looked at as, well, they're just not behaving. They just won't listen. They're just being unruly. When in fact, They're really calling out for help. Their actions to us as adults need to say, wait a minute, what's going on here? But when we don't have the knowledge about trauma, and we're not trauma informed to understand that that's what's happening, then it's, I can't handle this child. I can't do this anymore. I mean, they're acting out, they're breaking things. Like, I can't do this anymore. So someone comes, takes the child out of that home, and there again, what's happening? I was safe here. I like it here. These people are good to me. And now you're taking me out of here. They must not like me. They must not want me. And again, that rejection just builds and builds. That was just huge for me to hear that example, because I'd never thought of it that way. So as we're going through, staying in these situations, a lot of older parents or grandparents are needing to stay home to protect themselves. Just keeping in mind that the child is perceiving this completely different, and based on where the child came from and the experiences the child had in the past, then maybe that leads to some conversations of, hey, how are you feeling? We do feelings check at our house with him all the time. Hey, feelings check, how are you feeling today? And it's helped him be able to put those feelings and emotions into words that he can then communicate to us, and then we can have that conversation. And that helps them grow. That helps their minds process what's going on and how they're feeling, so that they can move past that. And I'll make these slides available for everyone, but these are just some impacts of childhood trauma on the development of their brain, some physical disorders, emotions. I mean, it just really affects everything. The relationships. So relationships are huge, and we all need relationships. We all need people that we feel have our back, and that we're together with, and that's going to protect us. And we all need that. I just really like this slide. It really kind of lines out some of the impacts of trauma on children, and just makes it a little bit easier to maybe understand where the child is coming from. We still don't know if school is going to go back into session next fall and what that's going to look like. I mean, I guess they said it was going to, but we don't know, what the parameters of that. This is all new things to kids. It's all, a lot of this is new to us, and we don't understand, it's kind of hard for us to, navigate through all of these different things that have been put on us this year. It's especially hard for children to understand why the things that are in place are in place. So just keeping in mind and really helping our grandparents and our kinship providers understand that there's a reason a lot of times when children are acting out and things aren't going quite right, but that those things can be corrected, and they can be corrected very quickly. Helping them understand that they can reach out for help. They can reach out. Reach for Tomorrow does trauma training, and we do a lot of one-on-one and even group trauma trainings. But being connected with an organization or something in your community that can support you as caregiver, support your understanding of trauma and what's going on, and help you understand maybe what's going on with this child, and help connect you to services that can work with your child through this, through everything that's going on. We can get through this, and we can help them be healthy and help their minds be able to process what's happened to them. It's just understanding why this is happening and what's going on. I also, back to the visitations and things, I don't know exactly what is going to happen with that. If they're starting, I'm hearing that they're starting to open back up again. Also keeping in mind that for those of us that have full custody, our cases are closed. So we're now responsible for visits on our own. If you have caregivers who are in that situation, what does that visit look like? Do they need help having a place for that child to now start visits again, instead of maybe somebody coming to their home? When the case is open, you go to the agency, or something like that can be done. We don't have that as when our cases are closed. So it's helping that person understand, and that caregiver, here are some options. Let's help find a place where you can take the child, and the child can visit safely, so that everyone is protected. And just really understanding that it's a work in progress. I don't think any of us really have all the answers. I know we don't, and it's just working together and unity, trying to make sure that we're hitting the needs of the child, but also looking at the caregiver. There's a lot of vicarious trauma that happens, with caregivers. We're dealing with, our child maybe being an addiction, not knowing what's going on with our child, or if we're going to lose our child, or maybe we've lost a child and now we're taking care of their child. There's a lot of things going on the side of the caregiver as well that I feel like a lot of times gets overlooked, but that's trauma on our side too. So just having a good support system around the child and the caregiver so that they can understand trauma, and then they can also have a good connection of resources and places to go to get support for that. And this is just another slide, just kind of, you know, how this is how trauma might feel to a child. Hair feels like it's standing on end. They get sweaty. Their heart beats fast. They get sick in their tummy. Goosebumps. Children don't understand why they're feeling this way. So it's important for us as caregivers to get all the information that we can, assess their situation and see how they're feeling, and then help be able to navigate them through these feelings that they're having. This is my contact information. You guys can reach out to me anytime, by email, by phone. This is our website. We do have a trauma, Children of Trauma course coming up. It's an online class, and it's going to be on June 27th, and I can send some more information out for all of you on that if you're interested. And you can sign up and take that class virtually. It does have CE credits with it, but it's a very good class to start with. It's a very good basic class to start with on trauma. So I'm going to stop my screen share. Okay.
Thank you, Beth. Up next is Veronica Burrows with the Ohio Department of Job and Family Services.
Okay, hello. I think I'm unmuted. Hopefully you can hear me now. Okay, I believe that you can. Great, thank you. And hopefully you can see my screen. I'm not I should be presenting the Ohio CAN update. And so hopefully you are able to see that. I just want to say thank you for having me. I really appreciate all of the speakers prior to me, and I'm a little nervous following all of that wonderful information. And so I'm really just going to be providing some updates from ODJFS. I did notice in the chat that there were some questions in regards to the GLSEN decision. Unfortunately, I will not be speaking in regards to that. That is not something that is within the purview of Ohio Kinship and Adoption Navigator Program. I did see there was a comment in regards to Connect and trying to balance that. Connect is really working in response to the Family and the Family First Prevention Services Act, which allowed states to receive Title IV reimbursement for Kinship Navigator programs. So it was in response more to that, and then to the state legislature, which has given the states some funding to start a Kinship Navigator program. So I just wanted to clarify the work that's being done with Ohio CAN and how that is different from GLSEN. So briefly, I will just give some updates because I know I have given updates to this group in the past. So the first thing that I want to note is just some of the services again. We are working very quickly to try to get everything done. We are doing everything remotely, and we have been, and still trying to stand everything up, offering webinars, trying to make sure that everything gets completed still in a timely way. We still plan to offer the same services, the statewide website and phone number. We will be working with families over the phone, providing information and referral. We will also be working with families in person, doing assessments, creating support plans, and helping them through case management. We'll also be doing training of navigators, making sure that the navigators stay tied into their community through regional advisory councils. So that's some of the information in regards to the services that we provide. We will be doing a rigorous program evaluation. That's part of what we're required to do to get onto the Title IV Prevention Clearinghouse, is to have a rigorous evaluation. That evaluation is not only going to be looking at model fidelity and effectiveness, but we also will be looking at implementation to make sure that we are implementing to the model. So we are currently in the process of creating the statewide procedure manual, creating program-specific training, and also creating the statewide documentation system. And as I had said, our ultimate goal is to be accepted into the Title IV Prevention Services Clearinghouse, which would then give us an opportunity to draw down further funds to continue to support and sustain our program. We are doing a staged rollout. We have already started the application process for cohort 1, which is the first 5 regions. We do have 10 regions. I will show you the map shortly. And then we're hoping to have the second cohort roll out in early fall. As we begin to stand up the program, we are in each region going to have 1 regional director and 1 regional coordinator. We'll have 1 coach per region, and then 5 navigators per region, and they will be housed at the local sites within the region. And this is the map. As you can see, we have divided the state into 10 regions. The blue is cohort 1. Those are the regions that will be starting first, and the gray is cohort 2. These are pretty evenly divided by population. We are looking at the Ohio CAN sites. I think I've told this group before that they are going to be community-based, both public and private agencies. We are doing this through a competitive selection process, and we're having those applications that these providers put in, we're having them reviewed by neutral reviewers across the state, so we can really get a good cross look at what different types of these will be new. The reviewers will be from different agencies, and so they can give us kind of their perspective of how they may be working with a navigator site. Each one of our the sites can apply for 1 to 5 navigators, so we're not sure exactly what it may look different in the different regions depending on what the needs are, and also the size of the region. If I go back here, Region 8 is a very, very large region from side to side. I mean, we're going from pretty much middle of Ohio all the way out to West Virginia. So, we have to take into account certain things like that as we look at who the Ohio CAN sites will be. And of course, they will be collaborating. We need to make sure that navigator services are available throughout the region. So we don't want to have, for example, in Franklin County, we don't want to have someone who will only service those people who are in Columbus. We really need to make sure that we're covering throughout the entire area, regardless of how rural or how urban it is. We started the applications for Region 1 in April. We have received several applications, and we are in the process of reviewing those applications. Cohort 2 has not been released yet. Then we also are working on the rule. The rule is in business impact analysis. It has been forwarded for review. We are working on the next steps after that, which will have it be original filed. There will be a public hearing. It will go through JCAR and then final filed and effective. So we still are on target to have our rule reviewed and approved hopefully by October. That's the update I have. Like I said, I wanted to be very brief. I know we're coming close to the end of our time. So I don't see any questions in the chat. So I'm just going to continue to go through. And hopefully you can see this is contact information for myself. Julia Donovan is the project director at Connect. So you can contact her as well if you have other questions. I wanted to go over just a couple of other things that are occurring at ODJFS, the Kinship Permanency Incentive. As you can see hopefully you can see my screen, there is 17,151 approved applications with 11,288 children served. And as of May 12th, there was just over $4 million in federal dollars and $1 million in state funding. So that's close to the KPI ceiling. So given the fact that we are implementing Ohio Can across the state is requesting a higher ceiling for the next state fiscal year. And finally, just to give a brief SNAP update, and I know Anna Beltran had spoken a little bit about SNAP and some of the waivers and other, and I'm seeing that I'm not sharing. It says that I'm screen sharing, so I must not be doing this correctly, and I apologize. Let me see if I can. Okay, someone did say that they can see the screen now, so hopefully now I am screen sharing, so hopefully you can see it. I apologize, I'm not the best with the technology. I know that I've been trying to use this for quite some time now, but I'm still getting used to it. So for the SNAP updates, as Anna had mentioned, there have been some waivers and some extensions to increase what families are able to receive during this time. So the Office of Family Assistance has received waiver requests from counties related to interview requirements. The recertification process has been extended for 6 months. So those SNAP recipients in March, April, and May also received emergency allotments to bring them up to the maximum allotments for their assistance group size if they were not receiving the maximum already. So hopefully that just gives you a little idea of what Ohio has done to increase the what families are receiving under SNAP. Those are all the updates that I have right now, unless there are any other questions. I'm not seeing any questions in the chat, but feel free to put those in there. And if there are no questions, I'm going to turn it back over to OGKC.
Thank you, Veronica. Up next is Karen Dawson from CareSource.
Good afternoon, everyone. Can everyone hear me? Great, thank you. Thank you for that confirmation. But first, before I begin, I would like to thank everyone for all the speakers. A lot of information, a lot of good information. I'm learning things as I go, and I'm very appreciative of what you do. So I just want to say thank you for what you do in the community. And you know, I hope this information that I give you could be a help to you as well. I'm going to start off with some information regarding CareSource as far as who we are. CareSource is a nonprofit health plan that is a national leader in the managed care. We are the largest Medicaid plan in the state by membership. We serve about 1.2 million people in all 88 counties, and 30 years experience in the populations across the state that we actually work with. Our mission statement is very simple. It's to make a lasting difference in our members' life by improving their health and well-being. As we go through this, I'm going to give you some timelines of our journey as far as CareSource. I'm not going to give you all of them because the 30 years is a heck of a whole lot, but I'll kind of touch on 2014, we celebrated our 25th anniversary. CareSource expanded in products to the Medicare Advantage in 2015. Our commitment is, as a nonprofit insurance company, is member-centric. We are accountable to our members and the communities we serve, and not shareholders. Who do we serve? The Medicaid population. I think everyone knows that of CareSource. And I'm going to talk a little bit about what that means. We serve from the babies all the way to the golden ages now with our Medicaid product. When the Affordable Care Act actually happened, it also gave the people that were between 19 and 64 who doesn't qualify for the marketplace or Medicare to apply for Medicaid. We're about, our market share in Ohio for the Medicaid is about 53.4. And then also we have a product called Marketplace. Marketplace could be for people that are self-employed, like barbers, hairstylists, anyone that could be self-employed and doesn't qualify for the Medicaid product. They can actually apply for the Marketplace. With the Marketplace, we do have a product, several different plans on the Marketplace. There are some what they call a credits that can be applied for premium. If you do need that information for anyone who is out there, it may not be for you, but someone that you're serving, I can give you that information as well. Also, in the silver plan that we have for Marketplace, we're at a 60% plan as far as percentages. We also cover the Medicare Advantage program. We have exactly 3 programs. We have a zero premium program, a $40 program, and then also a program for people who qualify for Medicare and Medicaid. I want to back up a little bit and talk about actually on our Medicaid side, we have 3 reward programs to help people stay healthy. We have our Babies First program, which is for new moms and babies. Then what happens is once they sign up, if they actually sign up at the beginning of their pregnancy, they can earn up to $150 to use from a card that we send them, a reward card at different locations in Columbus, as far as different things like wellness products that they can use during their pregnancy. After the baby is born, then that kind of transitions to the baby as well for doing the wellness checkups and things like that. Then we move into what we call our kids program, our Kids First program. That is for children from ages 18 months to 18 years old. And it applies to every child that is on CareSource in that household. So each child would give an actual card, and every mother needs to sign up every child that's in that household. Same scenario where they actually, for doing checkups, dental appointments, annual physicals, they get monies put on that reward card to spend at different locations to buy certain items. And they'll get, in both of these programs, they will get a letter, a card, and also information about what they can buy and where they can buy these items at. Then we have the Women's First. That is for women who are 19 years old to 64 that doesn't qualify for the Marketplace or Medicare. And it's a little bit different from the reward program. With the Women's First, for doing annual physical, pap test, mammogram, they actually earn points to buy gift cards like home goods, my favorite place, Panera Bread, and Marshall's, on iTunes, places like that. So they have to pretty much call in on all of these programs and just register themselves to be on either one of the programs. And if there's questions, please put them in the box so I can answer that for you. As I go on through the presentation regarding what I do in the community, I am a community marketing rep. I've been with CareSource for about 4 years. My job is to, I should say my opportunity is to educate on the services that CareSource has. We have another program for people that are on CareSource, which is called Job Connect, which is very in line with our mission statement to make a lasting difference in our members' life by improving their health and well-being. Job Connect program is kind of different from what I do. Their job is to, or their opportunity, I should say, is to help our members become self-sufficient. what happens if one of our members wants to work and they call in and say, I want to go through the Job Connect program, we'll help them with their actual resume to help them, well, not to do it for them, but help them with it so that they can actually sell themselves in an interview. And it's really neat because they get a actual life coach for 2 years. That life coach can help them navigate through food insecurities. We know that at some point in time, they're going to come off the Medicaid program. They can transfer into the Marketplace program. Anything that they need help with as far as becoming self-sufficient, that life coach is there to help them. Also, if they want to go to school, well, let me back up. We also have employers that will actually look at them if they want to be in those fields that we have available as far as job opportunities. And it makes it a real good mix for them, because it's kind of neat, because even if the children are on CareSource and the parents are not on CareSource, the parents can still apply for the Job Connect or work with the Job Connect coach. If they're going to school, we don't pay for it. However, we do help them with the actual finding of what they want to do, the paperwork, and making sure that they're on a steady path of improvement during school. They get a life coach for 2 years as well. Our Care for You team. Our Care for You team is pretty much nurses that works with our clients that may be battling, children who may be battling asthma or some type of behavior, services that they may need. And basically all they need to do is to call into CareSource and ask for someone in Care for You. Some of the services that they offer is course care management, disease management, tobacco cessation, women and children health, behavior health, wellness, and health risk assessments. As I mentioned, Life Coach, we have more than 9,000 members that have interacted with our services as far as the Life Coach is. And employed members, we have right now 1,239 with 208 employer partners, and members who have retained employment, 67%. Our foundation, we do have a foundation where we work with our community partners with economic stability, safe, healthy homes and neighborhoods, access to care and physical and mental and behavioral health, and several other categories. If you look on the website, we are not doing anything right now with the foundation. We're actually working with some of our community members to help them keep doing what they're doing in the community until further notice. But you can ask me about that if you have questions. I am available for presentations to staff and presentations like this, even though we are not out in the community as I speak. Not sure when we're going to be out right now, but we have been staying in front of our members, or I should say our community partners, with information regarding any changes that come out, any information that I actually get from other community members that might be interested or might be an interest to some of my other community members. So if you have questions, or if you have staff members that want staff presentations, virtual is always good. But if you need information as far as brochures and things like that, those can be shipped to you. If you have questions, I think my information will be put out on the website, so you'll be able to see it. But if not, please feel free to call Ron. He has all my contact information, and I would be more than happy to either send you information, do staff presentations. If you have events coming up that maybe, hopefully when we're back out that I can attend, I would love to do that as well. Does anybody have any questions before I sign off?
Well, thank you, Karen. Up next, we have Dr. Jones to wrap our webinar up and give us some final thoughts and some housekeeping notes for future endeavors that OGKC will be doing. Dr. Jones.
Thank you, everyone.
Can you hear me? Can you hear me? Yes, great. An awesome time to spend and talk about the coronavirus and how it's impacting our caregivers. And I wrote down some notes as I thank all of the speakers for such an awesome presentation. I wrote down such things like fear, trauma, trying to keep children occupied throughout the day because they're not in school. I thought about things like culture competence when we talk about working with caregivers, and also culture sensitivity. I thought about spirituality, faith, and trust in God. But above all of that, I thought about self-care. And so when you're talking to your caregivers, when you're talking to your families, even with yourself, you have to think about self-care, because sometimes we can stay in front of CNN too much, that it begins to become overwhelming when you keep hearing the same things repeated over again with new stuff coming on. So I encourage you to look at self-care for yourself, and then self-care for those that you are working with. Those are just some things that came to my mind as you were speaking. We look forward to having many, many, many more webinars, and some of the webinars that we're having that's going to be coming up will be, we're going to bring in the attorney who was on the Glisson case in Kentucky. We're going to bring him in and we'll do a webinar with him. We're also going to be looking at some mental health issues as it impacts kinship care placement, the caregiver, and the children. Support group networks. If you go to the Ohio Grandparent Kinship Care Facebook page and on their website, you'll see some things coming up with some support group, groups coming in June, in the middle part of June. And we're also looking at doing some area on aging, collaboration on aging, in terms of how do we look at sustaining placement as the caregivers are getting older, making secondary plans for the children who are in their homes. All of those things are going to be critical as we move forward in 2020. And then the last thing we're going to be looking at, another thing, is grandparents and other kinship care advocacy. It's one thing for us to advocate for them, but also to teach them how to advocate for themselves. So those are just some of the webinars that we're going to be doing in the future. I encourage you to go to our website, and I encourage you to go to our Facebook page. There's a wealth of information on our Facebook page as we move forward in 2020. I don't have anything else. Thank you so very much for coming. Let other folks know that this is going to be going on a regular basis. We will also be having our coalition meetings via Zoom. So stay tuned. Thank you so very much. Stay safe and stay healthy in your minds. Thank you.